this is Brandon with ChiroUp. Today we're going to talk about muscles. Not your best technique to treat the muscles, or the one that's the best one in the new research article that just came out this month. It's what are you actually doing to treat muscle hypertonicity? If your answer is a certain technique, then I think you've missed the boat. If your answer is a certain exercise or a certain piece of ADL advice, I think you're also missing the boat. It takes all of those things to treat muscles. Most importantly, the central nervous system. Now, I'm not talking about some fancy way of measuring brain waves or some crazy way of altering the neurology of somebody. It takes changing habits, it takes changing hobbies, it takes changing the repetitive stresses and the continual sustained load on the spine or in any part of the body that the muscles are interacting with. Because muscles are designed to have a lot of tensile strength and load across them to create compression and purposeful movement of the joint. However, when you do too much, when you don't give your body enough time rest, when there's an injury, that's when bad things happen. That's when people come to see us and they say, I've got a pain here when I do this movement, when I do that motion. And our job is to get those muscles to relax. So how do we treat those? Manipulation, myofascial release, acupuncture, instrument system manipulation. There's an infinite number of things we can use, and they all have some validity. However, what else do you do? What else is in your toolbox? Patient education should be a huge component of this, the active care, learning what's causing their problem and fixing it, whether it's their workstation ergonomics, whether it's the way they sit in their car, or the way they throw a baseball. You absolutely have to correct the etiology behind that muscle hypertonicity because their brain has an idea of what they want to do, and you need to make sure that their brain has the right idea on what they want to do. Have you ever seen somebody, let's take a rotator cuff problem, they start to move their shoulder like this? Well, they have a weakness in one muscle, everything's tight in here, and now the whole thing moves as one. The scapular muscles, the rotator cuff muscles, there's so much stiffness and compression in there, that compression's creating increased amount of tendinopathy, usually in the supraspinatus, and it's a perpetual cycle of getting worse and worse and worse. Until you teach that person how to separate that scapular range of motion from their glenohumeral range of motion, you'll never get them better. So we absolutely have to not only treat, in this case, the rotator cuff, in the case of the blog, the lumbar spine erectors and core stability, we have to treat how they're moving. This is something you have to do in your practice. Don't treat runners if you don't see them run. Don't treat people who lift boxes and have pain if you don't watch them lift a box. Make sure you're getting to the root problem, because if you don't, your PVA is going to go up, but my opinion of you is going to go down, because we absolutely have to provide that kind of value to our patients that we're going to get them out of pain and we're going to keep them out of pain.